Welcome to this video that we're entitling Haitian Dental Clinic 301 Made Easy. We're at Child Hope's International School, Maison de la Vie. It's a part of the orphanage here that the Manasseros started about 8 years ago. And by the way, the date right now is in January 2012. We, last year, or in October of 2010, before that, Chandra, our hygienist here, Dr. Slone, Chuck Slone and Chandra Shumar, Chandra had a dream after the quake about coming down to supplement the feeding program that the Manasseros and Child Hope put together with the need to have a good dental care. And obviously there's not a lot of that here. But with that, we were very, very blessed that God used that. And the first trip when we came down in October 2010 brought in over $50,000 worth of donated equipment so that the dental team could come down and do much more than the basics, the 101 version of only being able to pull teeth and doing some real basic cleaning. We've been fortunate, and God has really blessed us now with our second trip, that we're seeing the results that from the first a year and change ago till now, the kids have responded by learning how to take care of their teeth correctly, from having a great cleaning and a lot of their fillings taken care of and whatnot, so that this time the differences in their dental hygiene was amazing. So we're fortunate to be able to see what that's doing, and we want to show you how we set up the clinic so that other teams can come down here and use all this equipment as well to have an ongoing care for both the children in the home and the employees, children of the employees, and the community as a whole here at Delmas 75. So come on in, let's look at the clinic and let Dr. Slone and Chandra give you a chance to see what they put together. As anyone who has been at Child Hope's school knows, we were just in front of the school. Upstairs are classrooms 1 through 6, and that now right at this point is taking care of approximately 35 children from the home and another 40 some odd children from the community. The downstairs here that we're getting ready to go into is the medical clinic that's here all the time. That's open a couple days a week for the people in the community with the nurses that live here now. And they've been gracious enough to dedicate some space in here to storing the dental equipment and for when the teams come down to be able to do that. So I'm going to turn it over from here to Dr. Slone and to Chandra and let them tell you about putting together the clinic.
Okay. We're going to go ahead and go right inside here. And this is our front desk. It's a little bit modest. And then over here is our clinic room to the immediate left. And we're going to get into this a little bit more detail, but just to show you an overview of what we've got down here. We've got our clinic room over here. Down here we have one bathroom. And this is a storage area where we keep a lot of the medications, drugs, things like that. And it's usually kept locked. Over here we have more storage. And then this back room here is where we keep a lot of storage, a washroom. You don't have any electricity back here, but we keep our compressor for the high-speed handpieces and things like that back here. And it's kind of a modest area, but it serves function really well. And right now we're going to go and get into some details of the actual clinical procedures here.
Okay, we're going to start by showing you the hygiene section unit, which is very easy to put together. It is not complicated at all. You start with the canister, which has these little lids that go on the top here. And it's very easy to put together. Basically, there's something that says vacuum and something that says patient. You're going to take this small hose and you're going to connect it to the vacuum. Go ahead and place the canister where it goes on the suction unit, and then there's a hole right here on the top that you're going to plug in the other side of this hose. Now we have the long hose, which now says patient. Connect this to the patient side. Go ahead and apply your saliva ejector, and now you push the power button, which we're not going to do because it's so loud, but you basically have your suction suctioning into that canister, which we'll dispose of at the end of the day. You can also go ahead and take a syringe sleeve and cover it up. And basically, you now have your suction together working and serving its purpose. Also, I'll show you the Cavitron unit. Cavitron unit will be freestanding with its own water supply. We don't have a water connection here, so the Cavitron will have to have its own water. You just basically get a freestanding unit, open it up, and you pour water in right here, and you now have a self-contained Cavitron unit. As far as the handpiece goes, this is also very easy. We have the slow speed. We have the mega torque machine here. You turn it on. It basically has a few pieces. This part plugs in right here in the front. And then there's also a plug in the back that'll plug into your power source. You just snap the handpiece on, and you can lock it and unlock it and add your prophy angles, which could be disposable or not disposable. And that's our hygiene equipment section. Thank you. I would also like to just let you know that the handpiece loves oil. It has to be oiled every day in the morning just by putting a drop of oil at the base and the bottom, and also a drop of oil at the top. If you don't run it with oil, it will get very hot. It probably doesn't hurt to stop midday and put a little more oil in, or it will overheat. This machine is kept here at the orphanage, and you'll find it stored in this white box right here that we keep in the closet, which is labeled Dental Mega Torque. Real quickly, we're going to review the dental records. You'll pick these up from the nurse. It's a chart that says dental records. Inside, you'll find the records on all the children, the staff, and the people that we are currently working on. The treatment sheets look like this. Basically, what we're doing is we're adding the name to the top, the date to the day that we're diagnosing the work that needs to be done. Treatment that needs to be done is marked in red, 2 occlusal composite, 3 occlusal composite. If we finished the record, then we put it in blue. If we did the treatment, it's in blue. 30 and 31 are in blue, and then we would actually date it on this side that we completed the treatment or not completed the treatment.
Hi, I'm going to now show you how to set up the suction for the dentist. Over here we have a unit which we improvise. This whole unit costs us under $50. We only have one real suction unit that we use for the hygienist. This is regular medical, which costs like $400 or $500. And then this thing for under $50 actually has much more suction than that thing does. And it's very, very easy to use. This is just a snapware container. We just simply drilled a few holes in it and put some feed-through bulkhead nipple connectors. The patient hose, live ejector hose, is attached to one end. We have this one capped off because we're only using one section at a time. Runs through, we just have a little tiny holder that we tape to the side of the table, just made out of a plastic bottle cap. And then this is our slide ejector, and the assistant is usually in this position here working. The patient lays down on this table, and the doctor is right there. And so she has the suction running all the time while we're working, and it's just very simple. Just pop this right back in here and hold it for us, just like that. This is the storeroom that Child Hope uses to keep all their pharmaceuticals in, and we're using this to keep a lot of our suction unit. Now, this is the window that you saw with the hose running to it, and this is the other side of it. We have this hose running in, and this is just simply attached to an ordinary shop vac. $29 from Lowe's, actually. And this is then connected to a little homemade rheostat right here, which can actually regulate the speed on the shop vac. The shop vac has actually got too much suction, and so we actually have to tone it down a little bit. Here we have an outlet where this is connected to. This entire facility is run by a generator upstairs, which is diesel powered, so we have to, at times there's a power shortage, we have to fill the tanks up with diesel fuel when it runs out. So that's one issue that we deal with here. But to run this thing, all we do is we hook this up and just turn on the shop vac, and you can see by regulating the power, it'll adjust the speed of the shop vac. Want to bring the camera in here? I can adjust the speed of the shop vac to almost a bare low suction, or crank it all the way up to full speed. And what we found is if you have one suction, if you're running one suction, you only need about 1/3 to 1/2 the amount of suction that the shop vac will provide. If you're going to use a high-speed suction, you need about 2/3 of that, 2/3 of the power. But it also makes the shop vac last longer, and it makes it a lot quieter too. And the reason we put that in this room is because a year ago we had it right next to us. And it's pretty loud listening to a shop vac all day long when you're working on patients. So having it in this room, shutting the window down, keeps about 80% of the noise in here when this door is shut. It's very, very nice.